Hi, my name is Dan Roman and I am with Roman Brokers, and welcome to my Turning 65 seminar that we're doing online for your safety and protection. We are wanting you to understand what your Medicare options, plan options are, and you're going to find out through this whole presentation there are many different options that you have. So my job is to help guide you through that process. And as you will see, that there are a number of different ways that I become qualified to be that guide for you. I am licensed, certified, and trained to understand how Medicare works. And every year I have over 80 hours, I think 80 is conservative, of certifications from different Medicare insurance carriers. Just to put it in kind of a context, attorneys and nurses and physicians, they usually need to complete an average of around 20 educational credit hours per year. And we're pushing 80 plus, probably more like 100. I also have every year an annual Association of Health Insurance Plan exam that I have to pass, which covers the basics of Medicare and fraud and waste and abuse as well. I'm also trained to use Medicare.gov as well as other electronic platforms that help me find the best prescription drug coverage at the lowest cost for you. Now, my service promise to you is unbiased opinion, and we're going to get into why I can offer that in just a minute. Also, education on all your Medicare plan options, not just one company's or one type. No cost annual benefit review. I'm here year-round. I'm local, so my services are always free to you. They're no cost to you, and they're no obligation. But if you become my client, I do a no-cost annual benefit review with you, so that you can be sure that you're still in the best plan. Let's face it, needs change. Every year we do a little review. You may not have to do anything, or if there's a new plan that's come along that you want to take a look at, or perhaps I have found there's a new plan that maybe I suggest you look at. Yeah, that's something we'll cover each year. And of course, I'm always available year-round for any concerns that you may have or plan issues, which is a big difference compared to some of the other agents that may be out there. So, why can I offer unbiased opinion to you? Well, there's two different ways you can access agents, insurance agents. One is called an independent agent, which is what I am. And the way an independent agent works is we contract with many different insurance carriers. The other is what's called a captive agent. Captive agents, or even just sales representatives, they work for one plan, and carrier. And that carrier may have several different plans for Medicare, but they can only represent those plans that carrier represents. You also may be calling a call center when you talk with a captive agent, and they may not even be in the state. That happens. So as an independent agent, because I represent most all the major carriers in Arizona and all of their plans, I can offer you an unbiased opinion about what plan looks like the best fit for you based on your doctors, your drug coverage, your preferences for hospitals, and even just your travel preferences or other preferences you may have. We'll take all of those things and combine them. I work for you, not for any particular carrier. So the other part of that fits in is that I am compensated equally by all the insurance carriers, and that is a real benefit for you. Again, no cost and no obligation to you, but I have no financial bias toward any one company since they all pay the same, and that's one of the reasons I like working in the Medicare space, because as long as your benefits and costs are what you need them to be, we can both be happy. Now let's look at your Medicare choices. So First of all, we're going to look at enrollment periods, and this is important to understand as you turn 65. Your initial enrollment period as you turn 65 is probably the most important to understand. It centers around your 65th birthday month. So that takes 3 months before, the month of your birth date, and 3 months after. And during that period, that's called your initial enrollment period, you can enroll in a plan and there will be no late enrollment penalties associated with that. If you choose to wait, or perhaps you were misled and didn't know that you had to enroll in that time and you enroll later, you may not be able to until another enrollment period, which is called the general enrollment period. But it's real important that we nail all this down and help you with understanding this process during this period so that you don't miss your initial enrollment period. Now, let's say you've enrolled in Medicare and you've also chosen what plan you want. Then come the next year or the fall, which is where the annual enrollment period usually happens from October 15th to December 7th. Let's say you're just not happy with your plan. Well, the annual enrollment period is a time where you can evaluate, we help you do that, your options, and you can choose another plan if you so desire. So you don't have to, but it is there available for you. Now, plans do change, and that's the time you would understand what the differences are going to be in the plans. So it's a good idea to have an independent agent such as myself to work with long term, not just with that initial enrollment period, but for every annual enrollment period as well. So let's say you got into a plan in the annual enrollment period. You changed from your initial enrollment period to a new plan in your annual enrollment period. And wow, there was a doctor that we did not talk about, and he's not in the network you want. Or maybe the cost of your new plan, depending on what type of plan you go with, is more than you thought it would be. Well, we have one more option to make a change, and that is during the open enrollment period. That's for people with Medicare Advantage plans, and that open enrollment period happens from January 1st all the way through to March 31st. That is a period that I call the whoops window, meaning whoops, we made a mistake, or hey, I didn't know about that other option, or you know what, I just decided I want to make a plan change. You don't have to have a reason, but you can make a plan change during that period all the way to March 31st. There is one other one that you should know about, and that's the special enrollment period. The special enrollment periods can be because you just have now dropped your employer health plan coverage and you're ready to get in a Medicare plan. You qualify for Medicare Extra Help, which is for people with low income subsidies. Maybe you are eligible for both Medicare and Medicaid. You have dual eligibility, as it's called, or you just moved into a new service area. All of those are reasons where you can qualify for a special enrollment period. So those are also important to understand. Now, once you've understood when your enrollment periods are, you really have 4 major choices for your coverage with Medicare. The first one is, if you're going to continue working, is to stay in your employer group plan. Now, what I find is the lion's share of people with their employer group plan, they may have higher copays and deductibles and co-insurance associated with staying in that plan than they would if they just went to an individual Medicare plan. Not always, but that's something I can help you determine, and we can look at your options and see what makes the most sense. Your second option is original Medicare. So let's say you got enrolled in Medicare Part A and Part B, and that is your hospital and your doctor's offices and labs and such. Original Medicare will have deductibles and co-insurance of 20% that you will still be on the hook for. The problem with original Medicare, as great as it is it's an uncapped risk. So if you ended up with $1 million hospital bill, which include labs and doctors' visits and all of that, you could potentially be on the hook for 20% of that $1 million hospital bill. Doesn't happen often, but it can happen. And that's why not many people, very, very rarely do they stay in just original Medicare. They then will opt to have a plan to supplement Medicare. So the second option that you have, or I'm sorry, the third option is a Medicare Advantage plan. And Medicare Advantage plans supplement Medicare, and that's not even really the right word to use, because what they really do is they assume the risk from Medicare, and they provide all the benefits that Medicare provides, but they go beyond that. And they do that in a number of different ways. I call it the pay-as-you-go plan type, because typically in Arizona you can find a really good plan with a very low or even no premium associated with it, and you just pay as you use the plan. So if you went to a specialist, you may have a copay associated with that. Go get a lab done, you may or may not, but you may have a copay associated with that. And the beauty of the Medicare Advantage plans is they also have a cap on the maximum you could ever pay in a year for hospital and medical. So they cap it's not an uncapped risk like original Medicare, they cap the amount that you could end up on the hook with every year. So there's two main types of Medicare Advantage plans. There are HMO plans and there are PPO plans. There are others as well, but these are the two main categories that we see people most of the time opt for. HMOs, you're very familiar with that already. Most likely your group plan is either an HMO, which stands for Health Maintenance Organization, or a PPO, which stands for Preferred Provider Organization. Both of them have networks, just as your employer group plan most likely does. Both of them have co-pays associated with them. Both of them will have networks, just like your group employer plan does. The big difference is with the Medicare Advantage PPO plans, you'll have in-network and out-of-network benefits. Now, all Medicare Advantage plans must cover emergency and urgent care no matter where you're at in the country. So you can travel and still have coverage that way. Out-of-network benefits, you're usually going to pay more. So you'll pay a little bit higher premium or copay or co-insurance when you go out of network. But you also have that option if you so desire. Your fourth option is true Medicare supplement. And the way those work is they actually pick up whatever Medicare has not covered. So original Medicare, if it's got a 20% co-insurance and you have a Medicare supplement, you're paying a monthly premium for that plan, they will then pick up that 20%. So they're limiting your risk to basically, after the Part B Medicare deductible each year, depending on what plan you get into, because there are various ones, you may not have any other out-of-pocket costs except for your monthly premium. So Medicare, original Medicare does not cover prescription drugs, nor does a Medicare supplement plan, because they're only covering that other 20% plus the deductibles for original Medicare. So you would also need to get a prescription drug plan, and that would also have a monthly premium associated with it. So prescription drug plans are, for the most part, going to be quite reasonable, but they do carry that additional monthly premium, and there may be a Part D, as it's called, deductible that is also associated with that. So that's a lot of options that I'm going to boil down in, as you can see in this slide, to really two key options. You've got Medicare, so you're starting with Medicare there. Which direction do you go? You can go with the Medicare Advantage plan that combines all Part A, Part B, and prescription drug plans in most of the plans, all into one plan, usually for a very low or no premium. And then you don't have to have any other costs associated with it on a monthly basis unless you use the plan. So co-pays and co-insurances may be with a cap on them. The other option is to keep original Medicare, add a prescription drug plan, and a Medicare supplement plan, all of which will have premiums, and you pay those up front, as I call it, for the convenience. The other thing I didn't mention about Medicare supplement plans is there's really not a network. You can go to any doctor that takes Medicare, and you can go to them in Cincinnati, or you could go to them in Baton Rouge if you wanted. So you're paying that premium monthly for that flexibility and that ease to use. So moving along from that, those are your options. As you can see, there's many different options that you may have that we would, again, help guide you so that you can make a very informed decision. So what's the Part B late enrollment penalty? This is important to understand, as I touched on earlier. If you don't get into Medicare, enroll in Medicare, centered around that 65th birthday, or we'll say it as your initial enrollment period. If you don't sign up when you're first eligible, you may have to pay a late enrollment penalty for as long as you have Part B. And that's the biggie that's important to understand, that never goes away. Once you're late, you will have a Part B penalty, and it's based on each full 12-month period that you could have had Part B and did not sign up for it. So that's a 10% penalty per full 12-month period, and that does not go away. So usually you do not pay a late enrollment penalty if you meet certain conditions that allow you to sign up for Part B during a special enrollment period. Now remember, special enrollment periods, let's say you're dropping employer coverage. That's one of the most common ones you'll see. If you have had creditable coverage with your employer, even after you turn 65, you can sign up for Part B with no penalty during the time, a special enrollment period that is coordinated with when you're going to drop your group health coverage and go straight directly to Medicare. So there are really 4 major areas that we discuss with you, and you can see that there's the form that we have is downloadable. You're going to be able to download this and maybe complete some of this. I'm happy to complete it with you, but the main areas are, if you're going to keep employer plan, there are certain questions we're going to go through with you to make sure that's the right fit. Or if you're looking for Medicare only, we'll talk about that, or Medicare supplement, or a Medicare Advantage plan, whether it's HMO, PPO, or what have you. So using this as a guide may help you kind of, it certainly helps us get the information we need to narrow down the number of options you have, because there are so many. So there are not just many plan options to choose from, but plan types. We've talked about some of those. Medicare Advantage plans are also called MAPD because they're Medicare Advantage with prescription drug coverage. There are Medicare supplement plans, and those are very different, as we've talked about. We did talk a little bit about prescription drug plans and how they operate either in a Medicare Advantage plan or stand alone with a Medicare supplement plan. And we talked about PPO plans, preferred provider organization plans, that usually come with a little bit higher monthly premium, but they do give you a little more flexibility in a Medicare Advantage setting. So I am here to educate you and help you make the best choice for your needs. As the old expression goes, 2 heads are better than 1. I have the knowledge about Medicare, and you have the knowledge about what you prefer and what your needs are. And we put those 2 things together, and we come up with a plan to give you the best plan fit for your current needs. So what do we do now? Well, you have a couple of options. And first of all, I want to thank you for staying with me for this presentation. Because you did so, we're going to give you a certificate to Grubhub so that you can use that however you see fit, and we will be emailing you that after you fill out the permission to contact you. There's going to be a link. There is a link that you can click on, and go to that form and complete it. That gives us the information and the permission to send you then that certificate, as well as contact you to see what further needs you may have. You can also download that evaluation form that I talked about earlier if you'd like to do that as well. You'll find that on our website as well. So if you have questions, this is the time to ask them. I'm here. Let's go through those questions. I'm sure there's plenty of questions. There always are. This is more complex than you may have thought originally, but it's really, we can help you get that simplified so it makes the most sense for your specific situation. Again, all my services are no cost, no obligation to you, and I'd be happy to be your agent.